want to thank everybody for coming tonight. Tonight, our panel is focused on providing medical facts regarding the monkeypox vaccine. I am Walt. I'm the president of 406 Pride and Resource Center. With us tonight, we have Eric Owen, the RiverStone Health Clinic Vice President of Public Health Services. Eric brings more than 20 years of experience in metropolitan rural health. Dr. Staci Lee from RiverStone Health Clinic also joins us. Dr. Lee is a graduate of Johns Hopkins University, Master's in Education and Health Professions. She did a residency at Mayo Clinic. Medical interests are the care of people living with HIV. Dr. Neil Koo from Billings Clinic. He graduated from the University of South Alabama College of Medicine. Dr. Koo is an epidemiologist with a specialty in infectious diseases. With us also is Jace Dyckman from RiverStone Health Clinic. Jace is the program coordinator for outreach and prevention. On behalf of 406 Pride and Resource Center, welcome. I wish to recognize RiverStone Health Clinic for leading this effort to support and educate our LGBTQIA+ community, and to thank all of you that joined us tonight. Thank you. Eric.
Thanks, Walt. I just wanted to start off with a little bit of housekeeping today. So first thing I wanted to say is that we want to make this a venue where people can feel safe to ask any questions that they might have. So to handle questions today, we're going to ask people to type them into the chat, and then they will come to me as the moderator. I won't disclose who asked a question when we're responding to it. Also, just want to reiterate that this is going to be recorded, but like I said, we'll keep the identity of folks who are asking questions confidential. Also, just as a disclaimer, I want to say that during the webinar, we'll be having a frank discussion about how monkeypox up to this point is primarily being spread during this outbreak and how to prevent getting monkeypox. This may include language that refers to anatomical regions of the body by their proper name, references to activities that put people at higher risk for getting monkeypox, such as sex acts, and the use of graphic pictures of different parts of the body with monkeypox lesions so people can see what they look like. If you're up for that, I welcome you to hang in there with us and participate in this discussion. And with that, we will go ahead and dive into questions. So, Dr. Koo, what is monkeypox? You're muted, Neil.
I would try that. Dang, can you scan it? So monkeypox is an infection that's typically characterized by pox-like lesions, a rash, so to speak. And I think for many of you who have been following the news, you see the classic big bumps on the faces, arms, and legs. This infection is caused by a virus that's found in the same family as the smallpox and the cowpox viruses. I do want to emphasize that even though there's the name pox in it, it's not related to chickenpox, which chickenpox is a totally different family and managed very differently. The other is that the term monkeypox is really more related to when it was first initially identified, although it's not, the virus is actually not inherently from monkeys. So actually, it's not very clear where this virus really resides as a reservoir, but it's speculated to be mostly in small animals, particularly mammals. This virus is still endemic in Africa, particularly in Central and Western Africa, and those who get the monkeypox usually get it from contact with an infected animal. Now, there are two different types, but depending on where you acquired the virus, is that these people can get pretty sick with monkeypox. The Central African Congo clade, or clade 1, which is what they're now called, is particularly can cause very severe illness and can have deaths up to about as high as about 16% of those who gets infected. The second type, clade 2, the West African strain, is a lot less virulent and causes lower degree of death, mortality rate, less than 3%. But I want to emphasize that even though those are kind of mainly what monkeypox have been traditionally, what we're seeing now is somewhat of an offshoot of the Western African strain. So the disease is a little less severe, but that the spread is actually a little bit different than what we have seen in Africa. And instead of from animal to animal, we're seeing a lot more of human to human transmissions.
Thank you, Dr. Koo. Dr. Lee or Dr. Staci, can you go into a little bit about how monkeypox is spread?
I'd be happy to. So right now, the way that monkeypox seems to be spreading is through contact with the actual virus in a skin lesion. That's the way that we see it spreading most commonly right now. So, and when I say that, I mean prolonged touching into an area, particularly where the rash is. An active rash, it can actually be a scabbed rash. So that risk doesn't really go away till that new skin is all the way over top of that lesion. So contact with the rash seems to be a big risk. And we are looking more into how easily spread this is through respiratory droplets, but we do think that kissing is probably a way that it can be spread as well. If we think about contacting the virus, right? So if you think about kissing and getting it that way, or touching the lesion and getting it that way, it shouldn't be a surprise that contact with items that have touched the rash is also a way that it can be spread. So through bedding, towels, clothes, utensils to eat with, toothbrushes, etc. Those are things that we also think can spread the virus. Right now, we do not think that it is spreading through casual contact with other people in public, such as grocery stores.
All right, thank you. So, Dr. Koo, why should we worry about this?
Very good question. So a couple of key points. One, the first is that since the first that the cases of monkeypox have been identified in Europe, the number of new cases has continued to increase since then. Like the last time I checked, it's globally it's about 42,000 cases. However, in the US, there's almost 16,000 cases have been identified. So the US is actually the second leading country with the second highest number of cases of monkeypox globally in the world. Now, one of the things I kind of want to notice is that, as I kind of pointed out, that the virus is typically endemic in Africa, and cases of monkeypox tradition, when it's seen outside of Africa, is usually travel related up until last year. So what makes this a lot unique is that the spread of monkeypox, instead of being related to travel to Africa, is now has much more related, has certainly changed, and the dynamic has changed, and now it's as a result is this is likely a result from the human to human transmission, which is more prominent than the animal to human transmission, which we typically see. More importantly is that, and this is something that I kind of want to point that the media hasn't really said much about, but that, you know, as bad as monkeypox is, it's one of the many of those who experience monkeypox actually has very painful lesions, and certainly the rash can initially start depending on which part of the body that is affected. Certainly, you know, if it's on the face and such, may be not as severe, or on the hands, but if it involves the genitals and the perianal areas, it could be particularly painful. And kind of wanted to share some of what we're seeing, that some of the photos that's been taken of cases of monkeypox and some of the location of which that monkeypox have appeared. So typically, one of the things about the monkeypox is that it's unlike the photos that most of us see on TV, is that many of these monkeypox cases, the rash, there's only they don't have many lesions. Typically, they're about less than 10 lesions per case, versus the what you see on the classic monkeypox from Africa, where they're covering, their pictures of people with the pox lesions on their faces, and their hands, and their feet and arms and legs. So this is so one of the challenges is that it's really easy for not just the person who gets monkeypox, but also clinicians when they're evaluating a patient with a rash to miss the diagnosis of monkeypox. So it's really important that if someone has, if you're concerned that you have monkeypox, that you really inform your clinician if there has been any suspicion that you may have contacted with someone with monkeypox, that you tell the doctor or the provider that that's the case. Now, these are some of the photos that have kind of come up from Europe, and these are the cases that was recently published in the New England Journal of Medicine. So these are mostly the oral, perioral, as well as the throat lesions in the throat. And as you can see, they can appear at different parts of the bodies, and compared to the classic monkeypox, typically doesn't involve the mouth or the genital area. This particular outbreak actually seems to occur more often in those what we call the mucosal areas. Again, monkeypox typically had not been traditionally present in genital areas, and these are several pictures from the New England Journal of Medicine article showing some of the other areas that of the lesions found during this outbreak. And this is also, and it can also involve the area around the anus as well as the rectum. So, and when it does involve these two particular areas, they're extremely painful. And many of those who suffered monkeypox rash in those areas have, they describe this as one of the worst pains that they ever experienced, and many of them are very reluctant to go to have a bowel movement because it's so painful. Now, these are some other more atypical presentations, but this was actually came out of was published a while back in a newspaper of a monkeypox lesion that was misdiagnosed on the nose. And just the other unusual areas. This is a monkeypox lesion that involves the eye. So unlike the classic monkeypox, the monkeypox lesions from this current outbreak involves many areas that we typically don't see. And so again, it's very important that if you develop these lesions and it's as a result of a contact from anonymous sexual partners or someone with monkeypox, that you let your provider know that that's the case, so that they look for, that would include monkeypox as a possible cause for your rash. Now, this was a series of photos that was actually recently published in several newspapers, but this came out in a New York Post. And what's really nice about this is because monkeypox lesions actually go through a series of changes. And so this gentleman, who happened to be an adult movie actor, acquired monkeypox, and he took a series of photos that shown how his rash has progressed. So, and and as you can see, that the rash is kind of change over time. Yeah, initially starts off with a little bumps, which then gets a little bit bigger. Then as time goes on, they develop a little dimple in them, what we call umbilications. And then after a while, they become fluid fill and they kind of crust over, as you can see on the middle three photos. And then toward the end, they kind of start scabbing over as new skin develop. And then finally the scabs come off, and then you have this fresh new layer of skin underneath. The top two photos, two series of photos, are usually the face where these lesions are typically very painful, and then as as the rash improves, they become much more itchy. Some of these, just like chickenpox, some of these lesions will leave some scarring. So, but not all of them. But just that they don't completely, go away, but that there will still be some evidence of the scarring. So. But so that's the second point I want to make, that these are very, very these are painful and that can affect many different parts of the area. But the third part is something I really want to emphasize, because this is just speaking as a member of the gay community, that we really need to kind of really be keen on, and that is that from the medical perspective, almost all of these monkeypox cases involve gay and bisexual men. Greater than 98% of the cases are. They're all very often associated with these cases associated with them having sex partners from online websites as well as smartphones. So apps such as Grindr, Tinder, Scruff, and those and such. Many of them involve multiple sexual partners and participate in group sex. And sexually transmitted infections occur very commonly in these groups. And there are cases, and they are cases of those who actually acquire HIV infections. So and finally, probably more importantly, is that it's part of this is very politicized, and that there's a fair bit of mis and disinformation about monkeypox and the stigma that's attached to this. Now, there's a lot of argument that monkeypox is a sexually transmitted infection, and it depends on how you define this. Is that it's it kind of skew the perception of this disease as someone who's really to a group of folk, those who are more sexually promiscuous. There are a lot of misinformation that this only affects gay and bisexual men, and that this is kind of reminiscent of what happened during the HIV crisis back in the 80s. And then finally, there's that many of these is associated with, as I pointed out, that many of these are associated with those who have sexual partners that they've acquired online or from the smartphone apps. And unfortunately, when this first disease was rolled out, many of the criteria for suspecting someone with monkeypox was really focused on those particular points. But I want to, because of that, it's really hard to kind of convince a general public that monkeypox and that anyone can get monkeypox. And then monkeypox is really not entirely just a sexually transmitted infection, but that yes, having sexual contact is just is one of the ways that people can get monkeypox.